So we're in the office, what do we do in the office? So we do preventative care, right? We give vaccinations, which we'll talk about in a little bit with the upcoming flu season. We do, baby checks. So when babies are born, we make sure they get their shots, they're developing properly. We do things called periodic health exams, or what some people still say annual checkups or annual physicals, where we make sure that everybody's health is on track. And we do cancer screening, which again, I'll get into a little bit later. We also do chronic disease management, so people with diabetes or hypertension, to name a few. We do a lot of counseling, so there's a lot of mental health and addictions issues out there that we have to deal with. And we also provide urgent care. So my office, for example, we're open evenings and weekends. We deal with sprains and bladder infections and coughs and that sort of thing. So that's just the office, right? And then what a lot of people don't realize is what we do outside the office. So family physicians do a whole bunch of things, including right here at Markham Stouffville Hospital. So some of us do low-risk obstetrics, so we deliver babies. Some of us work in the emergency department. Some of us work in long-term care facilities. We do palliative care, what some people call end-of-life care. Some people work actually as hospitalists. They take care of inpatients when they're not in the office. Some people do specific care with cancer patients. They call them GP oncologists. And I also do some rehab medicine. Markham Stouffville actually has a rehab unit at the old Humber River Hospital before they built the new big, all digital, no paper place. We have a unit there with some other hospitals where we do rehab medicine. So there's a lot of work family doctors do even outside of the office, and especially up in Uxbridge, which is our sister hospital, where it's more rural. Those family docs are doing a lot. They refer very little to specialists because there aren't as many specialists there. And then the final part of what we do, which is obviously my most favorite, I'm just kidding, it's the administrative role. So we write notes every time we see a patient. We fill out insurance forms, return to work forms. We send secure emails to patients. We phone patients. We renew prescriptions. We send referrals to specialists, etc. So just bear in mind when we're doing that admin work, please be extra nice to our staff, because when they're not checking you in or calling you, they're helping us with all that stuff. So when you mention quarterbacking, and I'm a sports fan, the family physician is your primary care provider. They kind of have to navigate and coordinate care for all of you. So we have to see the field and always prepare for the next play.